Nurses, and how they are portrayed on screen. Most television and movies center around the role of doctors. Nurses usually have minor roles, with few exceptions. In this video, we will attempt to highlight some of the things that TV gets wrong and some of the things that TV gets right when it comes to nurses. First up, most of your interaction with the hospital staff in your room will be with the nurses, CNAs, and pretty much everyone except for the doctors. Certainly the doctors do stop by, but doctors have many patients and can generally not spend more than a few minutes with each patient for routine interactions. Most of your care will be provided by the nurse and the medical tech, from medications, hygiene, samples, trach care, feeding, IV care and management, assessments, education, and more. Doctors stop by for more advanced procedures, assessments, and consent and also when there's a need. Next up is charting. A lot of time is spent in healthcare entering information into a patient's chart. On TV, whenever they show the nurses station, usually they are full of nurses talking and chatting. In reality, most of the time there is spent entering information into a patient's chart and checking about new information that was entered into the patient's chart. Some of the information that may be documented in the chart are hourly rounding, medications, vital signs, assessment findings such as skin, neurological, etc., volume of the liquids in and out, and details about stool and urine if indicated. In nursing, the saying goes, if it's not documented, it didn't happen. So needless to say, countless hours are spent at a computer documenting every aspect about your care. As mentioned, nurses also watch for information entered into your chart. For example, when a critical lab value is noticed, the nurse is usually expected to notify the doctor about the value. Doctors do chart as well, but in a hospital, they often utilize dictation services and focus more on the specifics rather than the overall picture. One of the main focuses in nursing is to advocate for the patient. So nurses are often put into situations where they need to question a doctor's order. Shouldn't we also check for this? Did you mean to order this medication or this dose? TV often shows a tension between doctors and nurses. Generally, this is an exaggeration, but it's not unheard of. Take a look at the next clip, which unfortunately does happen.
Are you sure that's the right diagnosis?
Well, I don't know. I'm only an intern. Here's an idea. Why don't you go spend 4 years in med school and let me know if it's the right diagnosis? She's short of breath. She's got fever. She's post-op. Start the antibiotics. God, I hate nurses.
Doctors and nurses come together during emergency resuscitation events. TV often shows a team of all doctors and almost always shows defibrillation at the wrong times. Nurses and techs are often the ones to notice when a code is needed, and once the code is called, the team arrives to resuscitate and or stabilize the patient. Here's a small clip of what that might look like.
He's stable.
If you modeled your view on what nurses did based on TV alone, you would have an incorrect idea of the role of the nurse. The nurse is your advocate in the hospital. She or he may be the one who notices a vital finding that leads to your diagnosis or saves your life, or maybe even saves you from a bad order. Nurses do not simply bring you snacks and medications. They may have to titrate your medications according to your lab values. They do not simply clean you up. They may have to assess your skin and wounds while you are out of bed or being turned. Most of your care is provided by the nurse, and I think it's time that TV does a better job at reflecting these roles.